Penhollow with Precision Regenerative Medicine in Scottsdale, Arizona. We're here to talk about who is an excellent candidate for regenerative medicine. There is no age limit. I have treated teenagers who are very active in sports who've had an overuse injury, for example, throwers, pitchers, and quarterbacks or tennis players who have an overuse injury in their arm, help return them to play. I have treated patients into their 80s and 90s because they're still vibrant and active and they want to remain so. So one misconception is that there's a certain age limit for regenerative medicine, and there is not. People who have osteoarthritis are great candidates. Rheumatoid arthritis is a different condition, and the studies have simply not shown that the rheumatoid arthritis joints respond to this. It's the inflammatory body against itself autoimmune disorder that simply does not respond. It doesn't mean that patients with RA can't also have osteoarthritis or OA, and those joints, as long as they're not in an RA flare, are responsive to regenerative medicine. So osteoarthritic joints, any age, people with tendon damage, muscle damage, ligament damage. Think about the collateral ligaments in the knee or even around the elbow or in the shoulder. We can use regenerative therapy to treat those things. So we can stabilize a joint, help prevent it from advancing into an osteoarthritis. So an injury that is acute, an injury that is chronic, an actually arthritic joint. So all of these patients make really good candidates for regenerative medicine. We can use PRP, which is your body's own blood that's been concentrated down and has a whole bunch of growth factors and anti-inflammatory cytokines. We can use Prolotherapy, which is a dextrose or sugar-based water to help tighten up lax ligaments, can go into muscles and affect a change there to stabilize the joints and help recovery of those muscles and joints. We can use your body's own bone marrow. That is typically for a more advanced case where we need some regeneration and some recruitment and placement of stem cells into the area of injury. All of these are available, but we don't know exactly what you would need until we sit down and have a conversation. If you have imaging, that's very helpful. If you have surgical reports or at least know very well what surgeries you've had regarding that joint or your spine, if we're talking about the spine, that's also very helpful. But every day when we meet with patients, we design a one-on-one therapy program because everybody's different and everybody's at a different stage. So we look at that. One size doesn't fit all, and I'm happy to speak about this with you at Precision Regenerative Medicine. Thank you.